So the current landscape of prostate cancer imaging with PSMA targeted radio tracers includes three FDA-approved agents. The first agent that was approved is gallium-68 PSMA 11. The second agent to gain approval was F18 labeled DCF-PYL, which is manufactured by Lantheus Pharmaceuticals and goes by the trade name Pylarify. And then the final agent is F18 labeled rhPSMA 7.3, which is Posluma and is manufactured by Blue Earth Pharmaceuticals. All three of these agents are approved for the same indications, and that is for imaging patients with newly diagnosed prostate cancer, for which there's concern of metastatic disease. So basically to stage newly diagnosed high risk and unfavorable intermediate risk patients. And then the agents are separately approved for imaging patients with a rising PSA after definitive therapy. And most commonly, that means imaging patients with biochemically recurrent prostate cancer. And then there is sort of a third indication, which is carried on the label of the gallium-68 PSMA 11, and that is for imaging patients to judge their candidacy for treatment with lutetium-177 PSMA radioligand therapy. And so that's basically the landscape of these agents as it stands right now. One of the current challenges with prostate cancer imaging overall is that despite the advancements that we've been able to make by using these PET radio tracers, we're still achieving fairly low sensitivity values. So if we look at the trial data that led to the approval of these agents, in particular in the setting of patients imaged prior to radical prostatectomy, we know that the sensitivity for being able to detect pelvic lymph node metastases is still under about 35%, in and around that range. Said differently, about 70% of patients who have nodal metastases, we still can't detect them with these imaging agents. Of course, 35% is better than 0%, which is essentially what we were doing with CT scan, but we still do have a ways to go. Another challenge with regards to the PSMA targeted radio tracers is challenges related to distribution. So all of these agents contain a radionuclide that's responsible for emitting the positrons for the PET scanner to be able to detect. And with that comes a radioactive decay or half-life associated with them. And so these radio tracers from manufacturing to actual delivery have very short decay times. So you have to have these fairly expansive and complex distribution networks in order to be able to get radio tracers to different imaging centers. And there are many parts of this country which simply don't have access to any of the three commercially available imaging agents for this reason.